Hi, this is Gary Collins and Heath Squier and Jonathan. I'm sorry, I've already lost your last name. I've blown it.
Vitale. Yeah.
Vitale.
Yes.
I was going to say it completely wrong, so I saved myself. But I want to make clear, I am Gary Collins, the
Yes.
creator of the Primal Power Method. I do not own Julian Bakery. I do not work for Julian Bakery. I do not live at Julian Bakery. Just so everyone knows, since there is some confusion out there as to that my name is Heath Squire somehow, no matter what I say or what I do. So I
Right.
want to make sure that
Yeah.
everyone clarify.
Yeah,
Yes.
I got that.
I'm Heath Squire. Just
Yeah,
to
the guy at the
clarify.
paleo hat is Heath Squire. But thanks for being on. And what we wanted to talk about first is you're a DO and what type of doctor that is, because people often don't know what a DO does, or osteopathic doctor, and talk about the difference between an MD, DO, and maybe an ND, just to clarify.
Sure. Well, first of all, thanks for having me on. It's a real pleasure to be here. And you bring up a really great point about the different types of physicians in the country. So everybody knows what an MD is, or sometimes referred to as an allopathic physician. And their equal counterpart is called the DO, which stands for a doctor of osteopathic medicine. So DOs do everything that MDs do. And more. So DOs are fully licensed to practice medicine and surgery in all 50 states, just like MDs. They also go to 4 years of medical school, just like MDs, and they also do residencies like MDs do. They actually can do MD residencies, and they have their own DO residencies, and they practice in all specialties and subspecialties, just like MDs do. So that's how they're similar. But how they're different is inherent in the osteopathic training, which occurs during osteopathic medical school and also during the graduate resident education. Inherent to them is a sense of holistic health, a sense of the body-mind connection, a sense of the body's inherent ability to heal itself, and the importance of the psychosocial model of health. So from day one of medical school, we're always trained to focus on taking care of the whole patient, not just the disease. We always look for health in a patient, not just disease, and we try to make sure that patients live as healthy as lifestyle as possible in the most non-invasive way as possible. So many people out there watching have probably seen a DO many times. You've probably been treated by one many times, but you just didn't know it. So we have a lot of differences, but we also have a lot of similarities. So then there are NDs, which stands for naturopathic doctors. And they are a little bit different in that they are only licensed in particular states in the country, and their practice is very limited. A lot of them base their practice on prescribing supplements and vitamins, and they're also very much based in wellness. But what they do not do is they don't do things like perform surgery and see patients in the traditional sense, although they do usually see patients at their office and do consults. They can also, oftentimes, they order a lot of different types of labs. For instance, they use a lot of saliva-based laboratory testing. They can test for hormones that way. So it's really a different approach to medicine, one that is separate from traditional medicine in America, but not necessarily worse. It's just not as accepted by the American population yet. But that may change.
Yeah, that's interesting. So, can you kind of walk us through on some of the types of clients you see, and
Sure.
possibly some of the ways in like how kind of maybe the results they've gotten through prescribed methods that you're recommending?
Sure. So I practice traditional family medicine here in Chicago, and I also do some online telehealth, which I'll talk more about later. But really, the patients are very similar in both. I deal with a lot of chronic disease patients. So patients with type 2 diabetes, patients with hypertension, high cholesterol, and obesity. Those are the big four that most primary care doctors deal with in America today. The approach that I take to dealing with these patients is very it's very multidimensional in its approach. Of course, I'm going to do some basic labs to make sure that they are healthy, to make sure that their cholesterol level is okay, to make sure that their sugar isn't out of control, to make sure their kidney and liver are functioning properly. But what I really prescribe people more so than any medication is a lifestyle that reduces sugar intake, so sugar and grain intake, to reduce that, and also that prescribes regular exercise. There's a lot of points that I hit with all patients. A big one is I don't like to see people drink anything other than water and occasional coffee. I don't like to see people drink really too much alcohol. The other thing is, in the country that we live in, I call people essentially carbivores, especially our children. Especially our children.
Yeah.
Whereas every food that you find, if you go to the grocery store, it's all just carbs and sugar and grains, and that's basically what people are eating, and that's why we're getting all this chronic illness in this country. So what I prescribe to people is, I say, you know, these lifestyle changes, which is inherent in my osteopathic philosophy of let the body heal itself. And so what I do is I find that when you take away all that sugar excess, which is really an addiction in America, a sugar addiction,
Absolutely.
Carbohydrate addiction, grain addiction, your body becomes addicted to it. When you take that away and you replace it with protein and plants, and then essentially build in your exercise, a lot of these chronic diseases are reversible. And a lot of people don't believe me, but I've seen it happen. Certainly not every disease, but there's many chronic illnesses which are reversible. Obesity, for many people, there's a genetic component, but it can at least be improved greatly. As can type 2 diabetes can usually be greatly improved, and I have seen people eliminate that type 2 diabetes just from these lifestyle changes. Same thing with cholesterol. So there is a big, I do want to point out, there is a big genetic component to a lot of these illnesses, but with the paleo lifestyle, exercise, a lot of them can also be reversed.
Now, going into you mentioned obesity being genetic, though, but hasn't some of that been, like, a lot of doctors are getting into like a ketogenic way to kind of break through that genetic predisposition of being heavy? Haven't you seen some of that, like, great success actually in that arena?
No, I have definitely seen success in that arena. The reason I bring up heredity and genetics is because I think that for some folks it's a little bit it's more difficult, but sure, it's still very possible. Nobody can ever use genetics as an excuse for anything. Okay?
Well, yeah. But would you say on the genetic side, are we talking more about, you know, epigenetics? Are we talking about gene expression instead of hardwired genetics, as far as genome or anything
Sure,
like that? I mean, there is a difference, correctly, because I think people use that as a crutch. They say, well, it's my genetics. And I go, well, yeah, it is, but are we talking gene expression, or are we talking about, you know, something hardwired that you've gotten through, you know, through traits of your parents that cannot...
That's a really good question. I would say the answer to that is we don't know for sure yet. I think it's
I love that answer. By the way.
I mean, we don't know for sure, but you know, even more so than genetics, there's a lot that, for instance, when children are raised in certain families, really obesity is a family problem for many families, and you know, their parents don't eat healthy, they don't instill in them good values for diet and nutrition. So that can be that's a crutch that some people lean on as well, saying, well, I don't have any healthy food in my house, or, you know, my kids demand to eat, you know, fast food or whatever. So there are a lot of crutches that people use. I think genetics, we don't know exactly the extent of it, but I do think that it's not as big of a crutch as people make it out to be.
Well, I totally agree with that. I agree, and I think that I teach that as well. I work with clients as well, and it's hard because you've probably heard it as a doctor. You hear a million excuses, and
that's right.
I always get that. I always get an excuse instead of taking responsibility. And one of the big things I tell people, the biggest challenge you will have is the mental challenge in the beginning. If you are not ready to change and you're not ready to tackle this and put in the work, that is another problem in society, which is completely outside of the genetic side of the house, or it's cultural. It's basically being lazy and wanting the quick fix and saying, you know what, yes, I'm overweight, but I'm healthy and I'm fine with that. And you're like, well, wait a second here. One of the results of being healthy and eating the proper diet is being lean. Now, will you be perfectly, muscular and, shaped like a physique model? No. But you will be lean. And that's the problem I get in with a lot of people is they use that crutch of, oh, I don't want to be lean or ripped. I don't want to do that. And it's a built-in excuse. And it's enabling. And that's a part that we're battling right now, me and Heath, with some of the things we're doing, is we're getting, we've been called body shamers. And I find that to be an interesting cultural aspect of America right now. And that's that everyone deserves a trophy. I'm special because I'm here no matter what I've done, and you must treat me that way. Instead of saying, you know what, you're not special. You have the ability to do special things, but you're not born, you don't drop out of the womb a special person. You are a person. You are a piece of protoplasm that will develop into wherever you want to go.
Well, you touched on something very interesting, and it's this laziness factor. And if you take a look at that, people usually gain weight in their stomachs, okay? So they're so backed up, their colons are so full of literally just crap that they need, we talked about cleansing to have improved energy levels. So that's one component. The second component being you have your hormones are all out of whack. Your estrogen levels are sky high. You're puffy. And when your estrogen level is sky high and your testosterone level, if you're a man or even somewhat if you're a woman, are not in line, and you have never had a blood test to see where you are hormone-wise, you're not going to have that drive to actually want to go out and accomplish anything. The first thing I always recommend is go get a blood test, see where your hormones should be, and then work with a doctor such as yourself, Jonathan, and get them in line. And a lot of your hormones will fall in line naturally once you start cleansing. You can take supplements and herbs, and also just by diet, naturally things will start to fall into place for you. And guess what? All of a sudden you start to have the drive to make better choices.
Yeah, your body will find homeostasis, and I think he makes a good point. Is I love people like you, Jonathan, because I am not an expert. I am not a doctor. I have a background and knowledge in exercise, sports, and nutrition, and I have a unique working for the FDA and U.S. Department of Health and Human Services as an agent, so I have a little different perspective on things. I have an inside perspective. But I always recommend people go to a doctor as well, and I go, hey, get a blood test. I'm not a big fan of blood tests all the time because it's a snapshot of that moment, but it does help. There is, and with you though, do you get this? This is the problem I get is they go, oh, I can't afford that. I can't do that, even though they're driving their brand new SUV. They just bought a 70-inch plasma or flat screen, but they're not willing to invest in their health. Do you get that a lot? That they're just not willing to spend the money?
Yes, healthcare in this country is very skewed, and you hit on a lot of good points. No matter how much health insurance you have, your health is your responsibility, and nobody cares about it as much as you should. Yeah. And it is, and what a lot of people do, because a lot of people do, certainly many folks are uninsured in our country, but a lot of folks do have good health insurance, and oftentimes they don't want to go beyond that. Meaning, if we want to do some test that isn't really covered, but would be helpful, which is sometimes a lot of these hormone tests or even simple tests that just aren't covered because they don't have the right diagnosis. They don't want to do that because they think it should be covered. It's almost like Americans have this idea that health insurance keeps them healthy, when really that's not the model for health insurance in America. We don't have a healthcare system. We have a disease management system. What we do is we wait for you to get really sick and have a chronic illness, and then we can manage it with medications. That's what it is. So we do not have a preventive health system, and that's what we need, because that in the long run saves everybody so much money at the end of the day, especially health insurance companies who their biggest cost is hospital stays and chronic disease management, which could really, a lot of that could be avoided through spending money on, quality food, paying attention to what you put in your body, taking responsibility for it, getting the tests and things like that. What we're seeing now is this second generation of healthcare, especially in the telehealth realm, which I work in, where patients are paying a little bit out of pocket to get some of these tests and professional consults done that they know is worth it, and they're starting to be willing to pay out of pocket for it because they know what it's worth. Even if you put that aside, you can even look at the alternative medicine market in America, how much money people spend on that. Amazing. Even practices like chiropractics are considered alternative, complementary and alternative. People spend so much money on that, on naturopathic physicians, on acupuncture, things that are very helpful, but the United States healthcare system considers complementary and alternative. Yeah. People are starting to pay out of pocket more for it. So
well, it's a machine. We know that. I mean, we're almost spending $3 trillion a year in healthcare, and we're not going in the right direction. We're actually going in the opposite direction. Obesity is going up. People almost, 2/3 of the population is overweight. All you have to do is walk around in any metropolitan city to see that. And I was actually, I'm in the process of moving to Washington, and you would think in a more rural setting that you would think you would have more access to some of the healthy foods, and you would see people who are slimmer. It's not true. It's across America. I mean, there is no haven anymore. It is affected everywhere in every place.
That's right.
Yeah, and you're in Chicago. That's a major metropolitan area.
That's right, and the Midwest has a problem with obesity, very much so. And I think it all really comes down to the American culture, but a lot of it is the food supply. A lot of it goes back to the grains that have been pushed in this country for so long.
Yeah,
because of our crops and agriculture, and it's just
you mentioned that a lot of your patients are diabetic, and you're treating people that are obese. And wouldn't you say that's obviously a direct correlation to the continual spike of the blood sugar, high sugar, high carb foods that are being pushed, when really a remedy for these people would be to follow a paleo diet that would be low carb, low sugar, and it would be the fastest way to losing the weight or shedding the fat, mixed with a little bit of exercise. And when I mean a little bit, maybe just 2 to 3 hours a week mixed with that kind of diet, you're going to get insane results. Wouldn't you agree?
Yeah, absolutely. I think that that most people agree that health is about 3/4 diet. So a lot of it is what you're putting in your body. Exercise is wonderful, and you need to stay active. But what I tell my patients is, if you can only focus on one thing, you got to be careful about. You have to focus on what you're putting in your body. Yeah. And you hit on some good points about sugar. And hormones. I'm really a big advocate for watching your insulin levels too, because we have this pancreas, which is a very delicate organ, and it is just every time you eat anything with carbs, it's pumping out insulin, and those beta cells do wear out, and that's what causes it. That's one of the reasons why people can get type 2 diabetes, and your body becomes either less sensitive to insulin, or the pancreas doesn't function as well. A lot of that can be avoided by focusing on the low carb foods, low glycemic index foods, which people need to learn more about, and just following that lifestyle.
Yeah, and avoiding the extremes too. Well, everyone wants a quick fix, and I always tell me and Heath talk about this. And I'm starting to use a new term. I'm not calling it low carb. I'm calling it right carb. It's because nature intended us to live basically a low carb, I guess you would call, or right carb way of eating.
That's right.
There's different cultures. Don't get me wrong. There's different parts of the world with different type of foods, but for the most part, America is a melting pot. And what I think we all agree on is the paleo aspect, or the hunter-gatherer diet, whatever you want to call it. Sure. It is a balance. It is the best starting point and elimination diet for anyone, I believe, in this country, period. You have to tailor it no matter what, but that is a starting point, and I wish people would understand that instead of going on these huge ketogenic diets thinking they can pound 3 sticks of butter a day, have some bacon and an egg, and that's going to help them out. and they think that's a natural, and they think what happens is they think that's a long-term solution. And anyone who knows anything about ketogenic diets is you will always plateau because your body is highly adaptive. And once it figures out what's going on, it's going to adapt, and you're going to stall because you're missing out on a lot of vital nutrients, especially this thing called fiber that you need, you know, and so you're going to go out of balance at some point.
Yeah, absolutely. Yeah, very important.
Would you agree, like, if regardless of if you're ketogenic or not, if you're consuming more calories than your metabolism can burn, it will cause weight gain?
I would say that is the medical belief currently, that it's calories in versus calories out. But there's a new movement about right calories, having the right calories and the wrong calories. So that's debatable, but the current standard is that, yes, it's basically a mathematical equation of calories in versus calories out.
Well, for instance, if a person's consuming 6,000 calories a day, yet they're only burning 2,000 calories, let's say, and they're not having a very active lifestyle, they're more apt to either stall or gain weight regardless of where the calories are from. I mean, we're talking like a way over abundance, not a reasonable amount, like 3,000 or something like that.
That's right.
Okay.
The calorie discussion is a very interesting one because there's some folks who say, okay, I need 2,000 calories a day, so I can eat 2,000 calories of donuts a day, and that's all I need to do.
Yeah, I wanted to preface that by saying, you know, regardless, even if it's fat, though, if you're consuming, you know, 6,000 calories and most of it's fat and you have very little protein, you're going to probably stall or gain weight. You know, even though it's good quality, you know, fat calories or protein calories, but you have to have some sort of balance. And we're not talking about donut calories.
Yeah, no, absolutely. But that's just one of the reasons why I'm not a big fan of even paying attention to calories.
Right.
At least I don't.
Well, but you have to have some. You have to have some rationale to not overconsume.
That's right, and that's definitely one of the rationales you can use. Absolutely.
The other thing that we try to preach is in a single meal is to really not take in more than 10 grams of sugar or 10 net carbs. Because you're going to have that spike. So I feel like anything over that, you really set yourself up to possibly crash afterwards. Would you agree with something like that?
Absolutely. I mean, you got to limit your sugars. I love the 10 grams a meal. I think that's quite a good goal for people to aim for. Most people, I would say, their meals are 75% carbs, maybe even more.
Oh yeah.
Seriously, I mean, it's really sad. It's really sad. But that's definitely a good thing to aim for. I like the talking about the fiber. It's important to get quality fiber. And I think I heard you talk on one of your shows about some good fiber sources.
Yeah.
That I was impressed with.
Yeah, we're big fans of like glucomannan and psyllium seed fiber, not just psyllium. And obviously, you know, limited amounts of fiber from nuts and things like that.
That's right.
Yeah,
not legumes, but tree nuts.
Yes, not legumes. We're definitely no legume preaching here.
I love
get me started.
Well,
and the thing is, Jonathan, I'm glad you actually watched our videos, which is pretty important to be able to understand where we're coming from. Because Heath and I, you know, we take this pretty seriously, and you know, we're older. I've been around a while, and you know, we didn't create this. My famous saying: I didn't create this in my dorm room with Justin Bieber in the background pounding away at a blog. That has caused quite a stir with that comment. But you know, and that's why we take this. We're passionate about what we do, and you have to be educated, and you have to know what you're talking about in order, you know, to help people and get them on the right path instead of jumping on a trend. And I'm sure you see it in your practice. This is a great way to, you see people come in, and I bet you've heard every diet known to man that they're on or trying, and you're all, oh my God, where do I start?
Oh, yeah, definitely. And it's funny seeing the trends, too. Like, I remember when I was growing up in the 80s, it was all about low fat. And then then it became low calorie in the 90s. And then finally in 2000 is when kind of people started talking about low carb. But then you started getting all these offshoots like, you know, South Beach and the Mediterranean and everything. So it's funny. I have patients who are on every diet and in between, and have tried them all. This is not because of my advice. They just kind of do whatever they want, and it's interesting. It's really interesting. And the research keeps coming out as well by very reputable bodies about these different diets. And it's interesting. I mean, there was just a study that came out this week by the American Medical Association saying that the most cardioprotective diet is not a low-fat diet that we always talk about, but it's actually a low-carbohydrate diet.
Yeah, I saw that.
I've always advocated. But, this leads me to another point, which I think is very important for viewers to understand. And you guys would probably really agree with this, given your very unique backgrounds in nutrition and everything else. A lot of healthcare professionals in this country, traditional healthcare professionals, don't really know that much about diet. I mean, they don't have the background that you guys do or that I do. But most of my background is actually from additional studying that I did on my own. I mean, the traditional physicians, traditional MDs and DOs in this country don't get as much nutrition teaching as they should. They do get voluntary.
In a lot of medical schools, most of them will get is 4 hours, and it's voluntary.
Yeah, well, exactly. I mean, I did have a nutrition course I took, and it was, I think that DOs do a little bit better job of that. But even as a whole, I don't think that anybody does a good job of it. And here's the other part: is even licensed nutritionists and dietitians who do have a lot of knowledge. Unfortunately, a lot of the paradigms that they have to follow are very traditional, meaning a lot of them are based on, X amount of carbs per day and basically 1990s style thinking, like food pyramid almost. And that's how a lot of hospitals are run, and how a lot of these, when you send your diabetic patients to a nutritionist and they give them these, at least a traditional nutritionist, who has to give them these, American Diabetic Association diet regimens, which are really archaic, and I don't think they're effective. And I think this all has to do with a lack of knowledge, even amongst medical professionals, about diet and nutrition.
Really. Oh, absolutely. It's come down to, I used to investigate doctors. Not good ones like you, of course. But no, I would find that it's so incestuous between the drug companies and the medical community now, that medicine is no longer taught. It is purely symptom prescribed. Look at my chart. Okay, you need this drug. I'm going to have to give you this other drug to counteract that drug, and this one to counteract the other two. Yeah. And that's what it's become. That's the modality. There is no true understanding of the human body and the relationship between the human body and the earth. I mean, that sounds very, very crusty and very earthy, but we've disconnected. That's where we came from. We are a part of this planet. And when you start to shortcut everything, we don't understand Mother Nature. And I'll be honest, we're not going to understand it during my lifetime, and probably the lifetime after it, and the lifetime after that. So I always say, just look at it in basic concept as a person. You don't have to be a doctor. Well, what would I eat to survive in nature? What would I have access to? And that answers a lot of your questions.
Absolutely.
But people never look at it that way because they no longer know what food is. They're all,
that's right.
What's in the forest? I don't even know.
Yeah, and I would also add, we don't know a lot about how the human body works, even though we think we do. We don't really know much at all. I mean, we have hardly any idea how the brain works. I mean, we think that we know a little bit about the pancreas, which we really don't, or the heart, we really don't. We don't know much at all, and I think it's dangerous in that some people think they really know everything about how the body works. But
I agree. And you know what? I always give this example too. I don't know if you'll like this, but I say, look at it as the universe. We know nothing about the universe. Not going in some far-off tangent. Basically, the human body is its universe upon its own. And there is so many things going on in the human body. There is no way we can possibly understand it and the biopathways. I just tell people, you know what? You don't need to know all that. If you just focus in on move, get some movement in, and eat food that would be abundantly around you, and figure it out. Paleo is the easiest method that we have right now that I believe in, and it is that simple. You don't need to go on a cyclical ketogenic diet unless you have a specific condition, and even that's controversial.
Yeah.
You don't need to go on an extreme low carb diet. You don't need to go and do an all protein diet. And that's what drives me nuts is it's these trends and these people that, okay, I like paleo now, but you know what? You can eat a bunch of beans. Okay, now we're going to put dairy in it. Oh, now we're going to add this, and it's no longer paleo, and now everyone's confused. And that's I think, where me and Heath are at right now, is there's a lot of confusion, even with the good path, because it's so cluttered with a bunch of false, bad information. Do you see that a lot, too, in your community, as far as people are they're confusing everything, and people come in and they're trying everything instead of focusing in on the simplistic,
Yeah, I mean, definitely. There's a lot of misinformation out there. I had a patient once who was who did kind of like a fasting diet, almost like a ketogenic diet, but when they did eat, they were not eating healthy foods, so it was kind of turned upside down. So, and a lot of people, they hear certain things. I think there's a lot of, also a lot of people listen to even what the government says in terms of what we should be eating. When they came out with the My Healthy Plate, these past few years, and you saw that there was that nice dairy component to it, which wasn't with the protein, but it was its own dairy component. And there's just so much influence, as you said, so much really monetary, financial influence on the United States government to come up with these diet plans that everybody should be on. And we see that everywhere from, every American thinks you have to have cereal for breakfast, because we're taught that since we're children. And it's exactly, me too. I still love cereal. I try not to eat it, but I love it, so it's it's all these ideas that it's like part of the American childhood is bad habits for eating. And then then we try to undo them. But that's why I'm a big proponent, because I take care of a lot of kids, and I'm a big proponent of making sure that parents introduce children to food, to healthy food, to vegetables, to meats, to things like that, so that they can acquire a taste for it, so that they're not just carbivores, as most of our children are in this country. Starts young.
It's called nutrition. I call it nutritional imprinting. That word's been thrown around the terminology, and it's by imprinting a child when they're young to eating the proper foods will eliminate or help eliminate them eating foods that they shouldn't, because now their palate has been trained to eat the foods they're supposed to. It's just like any human. We have this overdrive for sugar because it's very rare in nature. So when we find it, we would gorge ourselves because it was this sugar dense, it's energy dense to get into our body for fat storage for winter, what have you, because we wouldn't find it all the time.
That's right.
But if you eliminate that from the beginning, kids, they've shown the studies, have a much better chance and are much lower obesity rating than the average American child.
Absolutely.
Can you tell us a little bit about telehealth and kind of what you're doing right now?
Sure, I'd love to. So I am part of a new telehealth solution called Helix Health and Wellness. You can visit us, if you don't mind me plugging it.
No,
you can visit us at helix.health. helix-health.com. We essentially are a holistic, wellness-based telehealth platform that cares for. We specialize in chronic disease management, but we also really focus in on wellness and lifestyle changes through counseling with patients. So we do order a lot of these labs that we've been talking about, a lot of the very special, unique labs. We order those as part of our service to the patients. But what's best about our service is you get one-on-one consultations with our professional providers, myself being one of them, who help counsel you about specific changes that you need to make for your health, and also making sure that you have the proper education you need and a wellness plan to help improve your chronic illness, but also, more importantly, prevent illness and promote well-being. So we are we think of us as an online concierge medical practice that's giving patients everything that they don't get in the regular healthcare world, even if they have insurance, because our providers are especially trained in wellness and in prevention, and we spend a lot of time talking about diet and exercise and mental health and stress reduction and things that primary care doctors in a traditional setting don't have time to talk about. We have time to talk about it with our solution. And so I'm really excited about it. We're launching in a few weeks. So I encourage people to check out our website and sign up if you're interested. But it's a great solution.
Go ahead and give the address one more time.
Yeah, sure. It's helix-health.com.
Perfect. That's awesome. Well, we want to thank you so much for being on the show. We'd love to have you back in the future. I think this is just confirmation once again about everything that Gary and I have been preaching, and we love what you're doing. I think it's awesome, you know, and I think we're all, you know, speaking the same message here. So, you know, we all want people to have optimal health, and I think we found a way to do that. So.
Yeah, and I really appreciate it. It's so much fun to be on. I'm glad that I met you guys on Twitter, and I'm happy to be back anytime. This is a lot of fun.
Awesome.
Please follow me on Twitter at Dr. Jonathan.
Yeah, awesome. Thank you so much. And if anybody has questions for Gary and I, you can email us at gary@theprimalshow.com and heath@theprimalshow.com. Make sure you hit the subscribe button so you can stay up to date with all of our most recent videos. And we'll see you all soon. Thank you so much.
Thank you.